Erosion of childhood immunizations. Policy shifts threaten public health. Recent changes to the U.S. childhood vaccination schedule, coupled with a shift in federal leadership, are raising serious concerns about the future of public health. While adjustments to immunization protocols are not uncommon, the latest decisions signal a departure from evidence-based policymaking, potentially undermining decades of progress in disease prevention. The new approach, separating vaccines, raising questions. In September, the Federal Advisory Committee responsible for vaccine recommendations voted to remove the option of a combined measles, mumps, rubella, and chickenpox (MMRV) vaccine as the first dose for children aged 12–15 months. Instead, the chickenpox shot will be administered separately. The rationale cited was a rare risk of febrile seizures, a generally harmless side effect already known to occur. This change, while seemingly minor given that many parents already opt for separate shots, occurs within a larger context. Public statements from former President Trump and his administration questioning vaccine safety. This pattern suggests broader ideological shifts at play, threatening the stability of the national immunization schedule. A proven system under threat, the U.S. childhood vaccination schedule, developed over the mid-1960s, has been a landmark public health achievement. It currently protects against nearly 20 diseases, including polio, tetanus, hepatitis B, and measles. Beyond preventing illness, it also reduces rates of certain cancers, like cervical and liver cancer. However, the appointment of anti-vaccine advocate Robert F. Kennedy Jr. to lead parts of the U.S. Department of Health and Human Services, HHS, and the subsequent replacement of expert members on the Advisory Committee on Immunization Practices, ACIP, with individuals lacking vaccine expertise have altered the committee's direction. The September meeting underscored this departure from scientific rigor, with discussions even extending to delaying the hepatitis B birth dose without supporting evidence. The real risks of fragmentation combination vaccines are designed to streamline immunization, increasing the likelihood of complete and timely protection. Separating vaccines means more shots, more doctor visits, and potentially lower compliance. The claim that combining vaccines weakens the immune system has been repeatedly debunked by research. The immune system is more than capable of handling multiple vaccines simultaneously, as evidenced by decades of safe and effective immunization programs. The true danger lies in eroding public trust and creating opportunities for outbreaks. Measles, a highly contagious disease, resurfaced in Texas in 2025 due to low vaccination rates, 82% among kindergarteners, far below the 95% threshold needed for herd immunity. Similar declines in coverage for other diseases could lead to preventable epidemics. The hepatitis B dilemma, the discussion around delaying the hepatitis B birth dose, is particularly alarming. Infant infection with hepatitis B carries a 90% risk of chronic disease, leading to liver damage and increased cancer risk. Since the Universal Infant Vaccination Program began in 1991, cases have plummeted from 18,000 annually to about 2,200 in 2023. Reversing this policy would inevitably lead to more children contracting and suffering from a preventable, life-threatening illness. A patchwork response the medical community, including the American Academy of Pediatrics and the Infectious Diseases Society of America, is actively working to counter misinformation and provide accurate vaccine information. Some states are forming coalitions to reinforce public health recommendations. However, a fragmented approach cannot replace a unified national schedule. Diseases do not respect state lines, and inconsistent policies weaken overall protection. Despite the growing influence of anti-vaccine rhetoric, polls show that around 9 in 10 parents still believe in the importance of childhood immunizations. Whether this confidence can withstand ongoing attacks on vaccine safety remains to be seen. The erosion of evidence-based vaccine policy is not merely a public health issue, it is a systemic risk. By prioritizing ideology over science, the current trajectory threatens decades of progress, potentially leading to outbreaks, chronic illness, and increased mortality among children.